I'm here with Dr. Chad Weber from Regenerative Neuropathy, St. Louis's neuropathy experts. We welcome you, Dr. Weber.
Thanks for having me as usual. Thank you.
I know that we've talked before about the frustration that you have in clients, not your frustration, but theirs, because they've been around the circuit of their doctors that are giving them what I'll call conventional treatment for neuropathy pain, and that is many times drugs, shots, things like that. And you have to convince them that not only is this neuropathy reversible, but sometimes the diabetes that can cause it is reversible as well, correct?
Yeah, I mean, that's one of the things people understand, like they're told they got to deal with this condition the rest of their life. There's nothing they can do about it. And if you catch these things early enough, in most cases, you can turn these things around and completely reverse them sometimes if you catch early enough. So
it's all about the techniques.
Yeah, I mean, you got to adjust your approach. I mean, I don't knock any of these patients for what they're going through. I mean, they're looking for help, right? So they're desperate. They're in miserable pain. A lot of them are losing their balance, losing their mobility, losing their ability to enjoy their retirement, right?
Right.
So they're looking for anything out there. So I don't knock them for what they're going through, but part of the problem is like you're not addressing the root cause of the issue. You're not addressing the root cause of what's causing this condition in the first place. So in today's world, we're kind of trained, or somewhat, I hate to use the word brainwashed, but it's like, hey, you know, you have a problem, here's a pill. You know, you got a headache, here's Tylenol, right? And that's not really how medicine or how healthcare should actually be. So our goal is to educate them and teach them there's ways to do this, but you got to start focusing on addressing the root causes of the problems.
Okay, let's talk about that primary focus.
So yeah, so basically you hear about, you know, traditional medicine, and our stuff falls under the umbrella of basically a functional medicine approach. So in traditional medicine, the primary approach is basically your standardized protocol. So you got symptoms A, B, and C. Here's pills 1, 2, and 3. We'll see you in 6 months. Our world, we're basically focusing on, you know, root causes of problems, personalized plans geared towards a person's health history, you know, their lifestyle, human biology, and kind of just trying to address the system as a whole and how the human body functions. And that turns into this, which is the body view. So most patients say, man, I got a doctor for my knees, and I got a doctor for my nerves, and a doctor for my digestive system. Most healthcare systems are not addressing the patient as a whole. Like we tell patients every day, we got to treat a human being as a human being, and with an integrated approach that's addressing all the systems to get an ultimate outcome. Most diseases or symptoms are a side effect or an effect of something that's gone wrong downstream or upstream, technically. So again, the body approach. Time. Every person you'll talk to in healthcare says, oh, I maybe never see my doctor. I'm there for 5 minutes. They write me a script. They send me home.
You feel rushed.
You feel rushed. You're not heard, right? So one thing about our approach is that our new patient visits are easily 30 to 60 minutes long. Part of that is, again, sitting a patient down, getting their whys. Like, why are you here? What are you concerned about? What's your health history? All of our patients go through an educational process so they can understand and have a true understanding of what's going on in their bodies, so they aren't just completely devoid of knowledge, right? Which is important.
And then we have the main tools.
The tools of the industry, right? So as we all understand, like pharmaceutical drugs and surgeries, pain injections are the modern tools of healthcare. Again, I'm not anti all medications. I'm not anti-surgery if you need it. But when it comes to the functional medicine approach, we're, again, multifaceted approach. What does your diet look like? So if you're a diabetic, we got to address that. Now, what is your overall lifestyle situation? Are you getting the raw materials your body needs to heal? So we're getting proper supplementation. And one of the biggest things I think that's different about our approach is the use of advanced technology. We're using specialized equipment that patients are using in the comfort of their house. So with this advanced technology, we can expedite recovery processes. We actually got new protocols released to us in January, so it cut treatment time by 90%. So it was an hour-and-a-half process into 35 minutes.
You were telling me about that there's some technology that these patients take home with them and utilize themselves.
And that's the beautiful thing about what we do. And we get phone calls from all over the country, believe it or not. But I got patients right now in 6 different states. And the beautiful thing is what needs to be done, whether you live 5 miles down the street from our office, live 100 miles away, you do it in your house. And that's the cool thing about it. It saves you gas, saves you time, saves you stress of going to doctor's offices all the time. It's beautiful.
Yeah. All right, so how can patients learn more about this process?
So we've been doing these seminars lately. They've been a huge hit. So the seminar is an opportunity to come out. It's free. You also get a breakfast with you. Come to Eckert's. We've got 2 coming up. It's about an hour-and-a-half long. You get some education. We do a Q&A session that allows patients, it's an open forum, asking me as many questions as we can get done in a timely fashion. And it gives people the opportunity to understand what is out there, you know, because again, a lot of people don't really, it's hard to explain in a segment like this, but to get a full understanding of how different this really is and what can be accomplished if they change their ways. So please take advantage of the seminars. It's a great opportunity to come out and learn more about what we do.
And you'll also get a copy of this book, The Regenerative Effect, which I've read, and I'm telling you, there's so many different approaches to this that we don't know about from the normal conventional medicine that we've been through in the past.
It's
and
amazing.
the free breakfast. So make sure to call the number on your screen and reserve your spot right now. The number to call, 618-232-4063. That's 618-232-4063.